Today I want to review questions with you. There are 100 questions on head and neck. I have broken it down into 5 batches. Each batch has 20 questions, lasting less than 5 minutes. Reviewing these questions will be beneficial to you if you are preparing for the boards or if you just want to broaden your knowledge base. So let's begin. Which intracranial bleed has a lucid and non-lucid presentation? Epidural bleed. In which 3 groups of persons is subdural bleed commonly seen? Very old, very young, and alcoholics. What is the most common cause of a subarachnoid hemorrhage? Ruptured aneurysm. Which aspect of the brain is responsible for alertness? The brainstem. There is ring-enhancing lesions on a head CT with contrast. What is the diagnosis? Toxoplasmosis. Where would the lesion be in the brain if the patient has bilateral hemianopia? The optic chiasm. What is your most likely diagnosis in a person with headache, high fever, and a stiff neck? Meningitis. What is the most likely diagnosis of sudden loss of vision with spontaneous return? Amaurosis fugax. What is the most common cause of retinal detachment? Diabetes mellitus. What is the diagnosis in a patient presenting with sudden onset of floaters, reduction of peripheral vision, tunnel vision, and a curtain-like shadow over the visual field in one eye? Retinal detachment. What is the diagnosis in a patient presenting with unilateral painful red eye, dilated pupils, and steamy cornea? Acute close-angle glaucoma. What is the diagnosis in a patient presenting with unilateral painful red eye, photophobia, and constricted pupil? Acute uveitis. What is the most common type of uveitis? Iritis. Which organism is associated with contact lens corneal abrasion? Pseudomonas. What is the most common cause of blindness in persons older than 60 years? Age-related macular degeneration. What is the diagnosis in a 75-year-old female presenting with extreme difficulty hearing high-frequency sounds in both ears? Presbycusis. What is the most common cause of hearing loss worldwide? Presbycusis. What is the most common cause of acute sinusitis? Streptococcus pneumoniae. What is the treatment of choice of chronic sinusitis? Augmentin. What is the treatment of choice of acute sinusitis? Amoxicillin. Well, thanks for participating. Remember, repetition is the art of recall. The more you hear it, the more likely you are to remember it. Continue to push yourself for excellence. I wish you well. Good night.